I incorporate John's technique into my practice on a daily basis, looking at my patients. Found a way to do a cast on you. Many of my patients are diabetic, so the indicator is just ever present.
My name is Marty Falera. We've been a patient of Dr. Tensar since 2003.
I'll also mention that he has a slight powdering to his face, which is indicated of a diabetic indicator.
Martin, are you type 2 diabetic?
Yes, sir, I am.
Okay.
Yeah, he's a diabetic. I'm so happy to see the progress that we have made with this.
Me too.
You don't understand what we went through to get this far.
And what improvements have you noticed?
Oh,
Holy mackerel.
well, we were getting nowhere. We were getting nowhere. In fact, his ulcer was even getting bigger.
We were trying everything, do it this, let's try this, let's try that. And everything else is just not cutting it. Let's try the electronic input.
All cells need voltage to operate. Cells need electrons. We're electrical beings. If his own body can't provide the electrons, what's wrong with supplying the electrons, giving it to him? And that's the whole purpose of his machine there.
Martin, you've got a plug there.
Okay. That goes into the 10 massager. It's a machine about this long.
Now this device that we got, you need to understand, is a $40 eBay item.
If you can imagine the upper ulcer being about like that.
The outline represents the maximum size of this ulceration.
And now it is shrunk to a third of the size.
Yeah.
And the bottom ulcer has gone to maybe a quarter of the size.
And this is after, what, about 3 months of going the other way? At least.
Yeah.
And then it wasn't until we put the electrodes on him and that we've seen this change.
And is this in the medical playbook, or is this your own idea?
Partly mine. It's not a novel idea, but it's novel in my practice, and it's not something commonly used.
Right.
But I think it's, now with what I see here, it's definitely something that needs to be spoken about.